Hello, and many thanks to everyone for joining and giving up your time to watch this short video of us introducing the North Central London Fertility Policies Review. My name's John McGrath, I'm a GP, I live and work in Islington, and I'm an elected GP member on the Clinical Commissioning Group of North Central London. As part of the work that we do as a CCG, we are coming together across the 5 boroughs of North Central London, that's Barnet, Enfield, Haringey, Camden and Islington, to bring together those fertility policies that we have into a single policy that will be relevant to you, a resident or someone registered with one of the practices in North Central London. I'm joined by Penny Mitchell, who is the Programme Director for our Fertility Policy Review, and we're going to answer some of the frequently asked questions that we've had through some of the work we've done. I'm going to finish by inviting people to come and contribute to our review and to really be very clear that we want to hear your experiences and your wishes for what you want to see included in this policy. I think before we start, as a GP, as a clinician, I recognise that everyone has a different experience of fertility in terms of a clinical journey and an experience of care. And whether you're in a heterosexual couple, a same-sex relationship, or a single person trying to conceive independently, it can be quite an anxious time. And just to reinforce the message that if you are affected by any of the issues that we're talking about, please do come forward, talk to us as GPs. We are here as your first port of call and willing to point you in the right direction. So with no further ado, we're joined by Sarah, who's going to off screen ask us some of the questions and we'll run through them together. So Sarah, thank you.
Thank you very much, John. So the first question, why is North Central London Clinical Commissioning Group undertaking this review?
Thanks, Sarah. It's really important to understand why we're here and what we're doing. As everybody knows, the NHS is busy with many different pieces of work. But as John said, the CCG has come together and we're made up of 5 previously existing organisations across North Central London. Now, CCGs have to have policies for certain areas of treatment to help make sure that patients receive the best types of treatment. And in the fertility arena, this is a really common area where CCGs have policies that specify what is available and who's eligible for those treatments. Now, because we were 5 previous organisations and have now merged into one, we still actually have those 5 separate policies that apply to each of those different areas in place. And we feel that that's not appropriate now we're a single organisation. And we're going to talk a bit more about that later. So we want to come together to form that single policy. So just to outline what we're doing at this particular point in time and what the review's coming, it's for us to understand different considerations and to produce some recommendations so that we can then develop that single policy. We're not actually making any decisions at the moment, but we're really interested to hear from our stakeholders. That includes members of the public, people who might be using services, people who might have used services previously, and from clinicians and specialists in this area as well. We're also doing a lot of sort of what you might call sort of research work and academic work to understand some of the latest evidence and make sure we're hearing about the latest guidance. So that will inform things as well. So we know that access to fertility treatment is really important to many of our residents, and it can be quite difficult and sensitive. So we want to do this work to make sure that we've got a single policy for everybody. We know that a lot of people would like us to make changes as soon as possible, and we would too, but we do need to make sure that we follow a really thorough process, and that's what we're doing.
Thank you, Penny. The next question is, what are the main differences in the 5 current fertility policies in North Central London?
Thanks, Sarah. So I'll take that one. So as Penny has indicated, every existing CCG or previous CCG will have its own policy, and those are made really clear and visible and published on the website for this programme as well. I think the 2 distinctions I'll make is around eligibility for access to fertility treatments. So that's about what is you as an individual, as a patient, what are your criteria for being able to access treatments? And those are broadly consistent across North Central London. There are a few minor differences which are clear whenever you look at the policies. I think in terms of what we're hearing from people is the challenge comes when there's a difference between the treatments that are funded. And particularly that's very obvious when you look at the numbers of IVF or in vitro fertilisation cycles that are funded in the different boroughs across North Central London. And that ranges from one full cycle of IVF funded in a number of our boroughs through to 3 funded cycles in Camden. And that's applicable for women under the age of 40. I think the other element which has really come through strongly has been the availability of funding for IUI or intrauterine insemination for female same-sex couples, which again is available in a number of our boroughs, but not in every one. The other key difference is around IVF or other fertility treatments using donor eggs or sperm. Routinely, donor eggs and sperm are not funded across any of NCL, but treatment using self-funded genetic material is available in some of the boroughs and not the others. So there are some clear differences between those policies, and I think as a single CCG, we clearly have a desire to make sure that everyone who lives in our area has the same eligibility, both in terms of access, but also in terms of funded treatments.
Thank you, John. Are the fertility policies in North Central London aligned with NICE clinical guidance?
Thanks, Sarah. So some people might be aware of NICE guidance. So NICE is a national body that looks at the extensive evidence and research undertaken by specialist clinicians and academics and researchers in all the different clinical areas. And they produce guidance that's available to all parts of the NHS to understand what treatments are evidence-based and how effective they can be and for what people and how they work best. John's just highlighted some of the areas of variance that we've got in our local policies, and we are aware that some of these areas of variance means that not all of those 5 policies are fully aligned with the existing NICE clinical guidance. NICE clinical guidelines are not compulsory. They are there as guidance, and it is the job of the CCG to decide how we utilise the funding available to us to deliver the best possible outcomes for all of our population. So we'll be using the NICE guidance to inform the local policies, and we'll have to think about where that alignment is not in place.
Thank you. So will the CCG seek to align the future policy to NICE clinical guidelines in full? And if not, why not?
So thanks, Sarah. So I'll take that. I mean, it follows on from how Penny's been just describing that. I think really clear to emphasise that this is not about making a decision at this stage. We are in the part of our policy review where we're really trying to hear the views of our community. And that's what we're really keen to get from this event. As well as the NICE clinical guidelines, we are being informed by current best practice. We're bringing together our current fertility providers, our specialists. We've got external scrutiny from an academic from outside of our geography. We have a steering group with community members and lay members as part of that. And the decision-making process is set out in terms of how we go and make these decisions, in how we spend the money that is allocated to us by the government to deliver healthcare needs across our entire population. I think, having said that, there is clearly a clinical desire to deliver best practice, and we would really want to be applying the NICE guidance in its full if we possibly can. I think if there are any areas where we have had to make really difficult decisions to deviate from that, the importance is that we are really clear and transparent about how we've come to that decision and are really clear about why that has happened. As a CCG, we have a statutory responsibility to reduce inequalities in terms of access to healthcare in our populations, but also in terms of outcomes. And that's hugely important, particularly in response to the COVID pandemic. And that's playing a really important part of how we're looking at some of the data that we have.
Thank you, John. And our final question today, how long will it take for the new policy to be confirmed? And when it does, how long will it take till it's available?
Thank you, Sarah. So at the moment, we're in this period of engagement where we're hearing from members of the public, from residents, and from clinicians across the patch. This period of engagement is open until the 9th of July. Once that closes, we need to take some time to really look at everything that we've heard and to digest it and understand what it might mean. We're also going to do that alongside all the other pieces of work that we've completed, looking at data, looking at evidence, looking at research. We're going to pull all of that together and develop a set of recommendations for drafting a new policy, and then we'll move on to the work of actually drafting the new policy itself. We'd like to note to everybody that we're going to have a second period of engagement when we do have that draft policy, so people can understand more about all the findings that we've got and how we've taken what we've heard and what we've learned and put it into practice with the new policy. So we're anticipating that a final policy is likely to be improved by the Clinical Commissioning Group in early 2022, with hopefully the policy going live shortly afterwards. And what is really important for us is that that should mean that everybody in North Central London then has the same policy apply to them.
Thank you, Penny. And I think just as a sort of a word of closing, this has been a fairly rapid a couple of minutes introducing the Fertility Policy Review and some of the frequently asked questions we've heard. We are aware that depending on when you're watching this, the 9th of July is probably not too far away. And we're really, really keen for people to contribute as easily as possible. Attached to this post is going to be a link to both our public-facing website, which has got a lot more details and information on it, but also a link through Twitter and our social media channels to our questionnaire. It's 2 questions. We really are keen to hear people's experiences and views on our existing policies and what you would want to see included in a future single policy across North Central London. Many, many thanks to those of you, the many people who have already contributed, and those are really important for influencing and participating in our policy development. This is a plea coming out from myself and the rest of the programme team. Please do contribute. Your voices are hugely important and we really want to listen to you. Thank you so much. Thanks for listening and bye for now.
Right.